A chance to help raise awareness by lacing up your walking shoes soon.
Our Amanda Faye recently sat down with a ProMedica doctor, and she's going to share how you can help.
Well, it's something that happens a lot more than you probably think. And with it being National Stroke Awareness Month, we wanted to learn more about what kind of research our local hospitals are doing. Dr. Syed Zaidi is a neurointerventionalist with ProMedica Stroke Network. Doctor, thanks for being here today. We appreciate it.
Thank you so much.
Yeah, so we were just chatting a little bit about this neurointerventionalist. So you're able to go in there and take care of things sometimes before they get worse, huh?
Yes. So that's,
He says no, not really, actually, but sure.
yes. So in our line of work, unfortunately, sometimes patients come to us really sick. And in interventional neurology, the goal is to help those patients with blood vessel problems inside the brain. So we use our catheter-based techniques. So if someone has a blockage of a blood vessel in the brain, we use our tools to go ahead, unblock that blood vessel. Or in instances of, say, aneurysm rupture in the brain, the goal is opposite, that is go inside the aneurysm and plug it up from inside.
Wow.
So that's the role.
There's a lot of things that you all can do. It's incredible what research and technology has, uncovered and developed over the years. So talk a little bit about stroke research and what you all are doing to help us along the way here.
Absolutely. And so again, strokes happen when the blood supply to the brain is interrupted. So if a blood vessel plugs up in the brain, the goal now is to open it up as soon as possible to help alleviate the patient's symptoms, minimize the brain injury. Stroke, unfortunately, remains #1 leading cause of disability in the United States. But it's more often than not, that's the reason why someone would be disabled, perhaps, can lead them to a life of disability, placement in nursing home, whatnot. So our goal becomes, when they are initially having the symptoms, #1, recognize the symptoms on the field. Call EMS. I mean, over the years, we have established a very well-developed EMS system locally that we are extremely proud of. And our EMS systems personnel, they're aware to recognize the stroke symptoms and bring the patients quickly to us in the hospital so we can go ahead and give them the treatment they need. From research perspective, we are always trying to broaden the horizons as to what's available for our patients. If there is, for instance, a blockage in a certain blood vessel in the brain, what's the best technique to open it? Is it just through simple medications that we can give to the IV line? Is it using a certain form of a catheter, a newer device which is not yet FDA approved, yet at the same time can be used in a research setting? So there's so many other options which are now available, and having research on board helps with that.
And there's a lot of clinical trials that patients can be enrolled in.
Absolutely.
And so that's wonderful as well.
Absolutely.
So you have an event coming up later on this year, but we're going to go ahead and talk about it now because it's May and it's Stroke Month. But you've got a 5K coming up in September, right?
That is correct. So throughout the year, actually, we do a lot of events for our patients and stroke survivors and their families, just to recognize the journey that they have been through and be part of it. So our stroke patients, the survivors and their families, we have the stroke race. It's an annual 5K event. We hold it locally at the Promenade Park. It's a really heartwarming event. It's a really cool event. So patients, survivors, their families, they come in either for a 1-mile walk or a 5K run, and we end up hearing these amazing stories of perseverance and patients doing amazing things in terms of their recoveries, and that's a great event because we can bring the community together. We can bring all the healthcare personnel together who provide the care for the patient, right? So EMS personnel who brought the patient to the ER. Wow. The ER teams, the ICUs, the cath lab team, the rehabilitation experts, they're all together with that patient in their journey. So the culmination of all of it is really cool.
Very inspiring.
Absolutely.
I imagine. And then is that raising money, for more research? Or?
Yeah, so the idea is to come up with a stroke assistance fund for our patients. So that fund can be used towards patients who perhaps cannot afford their medications or their, in some cases, some of their bills for their groceries and whatnot. Because stroke being disabling can have a significant financial impact and burden on the patients as well.
Oh, so wonderful. So this can go right to those patients.
Absolutely.
Wonderful. So people can be part of this. I imagine they can just register, sign up. September 15th, again, is the race day for that. And is registration open now?
Yeah, it is open now. It's through runsignup.com.
Easy as that?
Easy as that, yes.
Wonderful. So thank you so much for being
Absolutely.
here today. And fast, I like that because it's the symptoms, right? Or the
That's
signs.
correct. Be fast, yes.
Be fast. Very good. Thank you so much, doctor, for being here today.
Thank you so
We
much.
appreciate it.